We're talking today about caregiving. Now, caregiving refers to a situation where one person is responsible for a large part of the daily functioning of another person, and especially if this is a chronic situation. So if you have typhoid, yes, I might have to do everything for you for a couple of weeks, but after that you're going to get better. Here we're talking about situations where the other person is unlikely to get better. Major mental disorders in the most severe forms of schizophrenia, dementia, things where the patient is really just not able to look after themselves. So as a caregiver, you might need to help them with their activities of daily living, feeding, dressing, bathing, etc. You provide transport, you provide financial support, of course you take them to the hospital and for medical visits, participate in their rehabilitation, etc. Now, this can be a huge burden on an individual. It can be a huge problem for a person. And the way in which you approach it and the way in which you deal with it is something that's important, and that's what we're going to try and look at today. Caregiving can often feel a bit unfair. I remember this client who was in her late 30s and still single. She had previously taken care of one grandmother and one elderly aunt who had terminal illnesses and required quite a bit of help for that. And she really enjoyed that in the sense that she valued that role and she cherished that she was able to do that for them. Her father was diagnosed with dementia and was kind of declining fairly rapidly. Around the same time, she was having this long-term relationship with a partner who lived abroad. And he finally said, why don't you move here? Why don't you get married? So it was so difficult for her to sort of decide, what am I supposed to do? On the one side, this is my future. On the other side, this is my father, who I love, who's looked after me his whole life. And I do this, I take care of people. How can I not be taking care of him? So it can really feel, sometimes it can tear you. And that can be quite hard to make choices, to be caring for someone. However, there are a lot of positives which are associated with playing this caregiver role. The first one, of course, is that we feel good about ourselves. It feels nice to be altruistic. It feels nice to be able to help someone. It can boost our self-esteem as well as our self-image. If this is a caring role that's valued by society, and it is particularly for women, appreciated when they provide care, then that also helps, because people around you also see that you're doing something useful. And of course, it can give a sort of meaning or purpose to your life to be able to help those around you. Of course, it also has its negative side. Caregivers can have poorer physical health, either because of the stresses and strains of caregiving. You're doing your full normal life and doing this extra thing, as well as a sort of an attitude which many caregivers have, where they focus on the person who's ill and don't take care of themselves. So there's increased risk for heart rate, obesity, hypertension, a whole bunch of problems, including in one study, a 63% increase in mortality risk for elderly spouses of caregivers as compared to control group. It can affect your mental health, helplessness, anger, frustration, loneliness. These are common experiences for caregivers, particularly with the mentally ill. And of course, you can actually have depression, anxiety, and develop other disorders like that. The more you can take your caregiving role as a positive, the more you can be realistic about what you can do and be willing to take help for the things that you can't do. The more you build your support network, don't isolate yourself. Don't say, oh my God, I can't tell anyone that my child has this problem and so I have to deal with it all by myself. That doesn't help as much. The more you do all of these things, the easier it becomes to be a caregiver. Respite is a very important term here. Respite means that you take a break now and then, that you build other parts of your life, that you have friends, you have a job, you have social contacts, you have fun things to do, you have interests, you have hobbies, and you can take time off where you are not giving care for anybody. Take a 2-week holiday, spend the day at the spa, get someone else to come in and help you, and give yourself permission to do this, because this doesn't mean that you're not actually caring for the sick person. It just means that in addition, you're willing to care for yourself.